Okay guys, so in this video we will be revising bacteriology. So this will be high yield, full of mnemonics, and it will help you as either you are giving the NEET PG or INI-CET or maybe FMG. So guys, let's begin with it. First of all, how do you classify? Okay, how do you start introducing to bacteriology? So either it may be cocci or it may be bacilli. Okay, so cocci it may be either gram positive or maybe gram negative. Same way with the bacilli, it may be either gram positive or gram negative. So we need to remember what are the examples of gram positive and what are the examples of gram negative. So how do you differentiate between gram positive and gram negative? This is done with the help of stain. Okay, so a staining procedure is there. So how do you go in sequence? So the sequencing come in and stain. So C is the crystal violet, I is the iodine, A is the alcohol which is the decolorizer, S is the saffronin which is the counter stain. So this is a very important question from MCQ aspect in all the exams. Now coming on to the examples. What are the examples of gram positive cocci? You have Staphylococcus, we have Streptococcus which are differentiated with the help of catalase test that gives bubble. Then you have Pneumococcus and you have Enterococcus. Coming to the gram negative cocci, you have only three things. So how do you remember it? The mnemonic is venom. Okay, so V is Velionella, N is Neisseria, and M is Moraxella. Only three things which are gram negative cocci. Okay, so this is Neisseria meningitidis, Neisseria gonococcal. Okay, now coming on to the gram positive bacilli. All the bacilli are gram negative except for the mnemonic, that is McDonald. So M for Mycobacteria, C for Corynebacterium diphtheria CD, NO for Nocardia. Okay, then this is for Bacillus anthracis, so A is for anthrax. Okay, L is for Listeria. Okay, so this sums up the A is for actinomyces, N is for nocardia, Listeria. Okay, so this sums up all the gram positive. Remaining all the Enterobacteriaceae family that you see, that is gram negative. So what are the Enterobacteria? E. coli, Klebsiella, Salmonella, Shigella, Proteus, Enterobacter. These are the remaining things. Now coming on to the organism that are oxidase positive. Okay, so almost all the organism that you see in the family of Enterobacteriaceae, they are oxidase. Vibrio, Pseudomonas, Campylobacter, Bordetella pertussis, Brucella, they are oxidase positive. Okay, and Meningococci and Gonococcal, that were gram negative cocci, are also oxidase positive. Okay, now there are some atypical organism causing pneumonia. Okay, the typical famous one is the mycoplasma, which is also known as the walking pneumonia. Okay, then there may be chlamydia or maybe legionella infection that causes pneumonia. Now coming on to the Staphylococcus. Okay, so Staphylococcus, how do you differentiate? We have catalase positive, we have Coagulase positive, and we have Coagulase negative. So Coagulase positive Staphylococcus is the S. aureus. And coming on to the Coagulase negative Staphylococcus, this Staphylococcus are typically catalase positive, and Coagulase negative is two species, Staphylococcus epidermidis and Staphylococcus saprophyticus. So how do you differentiate it? So I have a mnemonic known as ESR. So what does this say? This epidermidis is sensitive to novovirusin, while the saprophyticus is resistant to novovirusin. This is the way to differentiate between Coagulase negative Staphylococcus. Okay, so Staphylococcus aureus, this is pathogenic, this is Coagulase positive, and this Staphylococcus, the MCQ that is asked, which is the most common cause of Staphylococcus which cause UTI in sexually active women. So the answer is saprophyticus. How can you remember? Staphylococcus, sexually, saprophyticus, and sexually. Okay, now coming on to the what are the virulence factor in Staphylococcus. Okay, so there is protein A, there is catalase enzyme, there is Coagulase enzyme. Okay, so there are two type of coagulase. One is the bound coagulase, one is the free coagulase. Okay, so bound coagulase is the one which is done on a slide. Bound has 5 letters, same way slide has also 5 letters. Now coming on to the tube coagulase, also known as the free coagulase. Okay, so this is done in the tube, 4 letter. Free is also is 4 letter. So there are 3 species which are positive to both, which is this Hysis aureus, and intermediate. So these are positive to all of this. So this, even if you don't remember, this will work. But we need to know. Name the organism which is only positive to bound coagulase. That is Lugdogenesis. That is, it looks like bound. Okay. Then free, that is Scliffery. So free name comes here itself. Then DNase, as the name indicate, it will cause breakdown of DNA. Hyaluronidase, that will break down the connective tissue. Then Staphylococcus, which is fibrinolytic. We know like altiplase, retiplase, all the kinases are fibrinolytic. Then coming on to the toxin. So they cause complete hemolysis. We know there are three types of hemolysis: alpha hemolysis, beta hemolysis, gamma hemolysis. Alpha is partial hemolysis, beta is complete hemolysis, and gamma is no hemolysis. So this is complete hemolysis, means it will produce yellow color. Okay. So now coming on to the, it has toxin. It has alpha toxin. This is beta toxin. Beta toxin shows very important MCQs. This is the hot and cold phenomenon. Okay, means it is produced at 37 degree, but the hemolysis is seen at 4 degree. Then this is very important question, that is synergohymenotropic toxin. That is pentan valentine, means PV toxin, and V you can make as gamma. So PV toxin plus gamma is known as synergohymenotropic. And you have delta toxin. Then you have toxic shock syndrome toxin. This is type 1, also known as enterotoxin F, which is a super antigen. Okay, then coming to the enterotoxin. Okay, so this is also a super antigen that causes food poisoning. Okay, so food poisoning, same 1 to 6 are, you have Bacillus cereus also. And you have exfoliative toxin, which causes Ritter syndrome in children and toxic epidermal necrolysis in adults. Okay, now coming on to the clinical manifestation. The mnemonic is soft pain. S for skin and soft tissue infection. O for osteomyelitis. F for furuncle. T for toxic shock syndrome toxin. P is for other infection. A for arthritis. I for infection. N for necrotizing fasciitis. S for sepsis and soft tissue infection. Okay, so see, this can cause nosocomial infection and osteomyelitis. O stands for osteomyelitis. How do you diagnose? On gram stain, this is a gram positive cocci and appears like a bunch of grapes. Staphyli means grapes. So it appears in a grape-like cluster. Now culture media. So for Staphylococcus, just remember how I remember it. I remember that one of the media of Staphylococcal is Ludlam's media. Okay. So what I do? Ludlam's. Okay. So one media. Other MSitans, that is mannitol salt agar. Now reverse it. SM, that is salt milk agar. So these are the three media that is used for Staphylococcus, and it is both catalase positive and coagulase negative. Okay. And you know, nowadays we have gone to methicillin resistant Staphylococcus aureus. So if methicillin resistant, we give the drug of choice as vancomycin. And if it is vancomycin, if it is VRSA, then the drug of choice is linezolid. Okay. See, nowadays cefoxitin is used as a marker instead of methicillin. Okay. And mechanism is gene transfer due to MAC gene. Okay. Most common disc method is the cefoxitin disc diffusion. This is a very important MCQ. Okay, and treatment of MRSA, I already discussed. It is linezolid or it is daptomycin. Okay, now coming on to the VRSA, I said. Then we talked about the coagulase negative staphylococci. Okay, so I said epidermidis is sensitive, ESR, and Streptophyticus is resistant. It leads to sexually active in young women. It leads to UTI, and this epidermidis, they enters the blood, they lead to the surgical site infection. Okay, so most common cause of surgical site infection is the S. aureus, that is Staphylococcus epidermidis, and it can lead to infective endocarditis within 12 months of surgery. Okay. Now coming on to the gram-positive cocci, other things that were Streptococcus, Pneumococcus and Enterococcus. So Streptococcus, as the name indicates, it causes rheumatic heart disease. Pneumococcus, it causes pneumonia, and Enterococcus we'll talk about later. So Streptococci, the first typical feature of differentiation is the catalase test negative. Okay, hemolysis, Streptococci causes complete hemolysis. That is beta hemolysis. I said beta hemolysis is the yellow colored complete hemolysis. Now this is gram positive cocci in chains. Okay, there it was gram positive cocci in clusters like a bunch of grape appearance. Now how it is classified? there is a Lansfield classification. Okay, he classified into 20 groups. Okay, A to V except INJ, that is 20 groups. Okay, so you have group A Streptococcus. This is classified further on the basis of M protein. You have group A, which is known as Streptococcus pyogenes, which causes rheumatic heart disease. B is the group B Streptococcus, that is known as Streptococcus agalactius, that causes neonatal meningitis. Then there are three organisms for neonatal meningitis. Guys, can you revise simultaneously? One is the group B Streptococcus, E is the Enterobacteriaceae, and L is the Listeria. So these three organisms causes neonatal meningitis. Other groups we have COD, that is Enterococci. Okay, so this is protein M, which is antiphagocytic. We have DNase enzyme, DNase A, B, C, D. Most common is the DNase B. Hyaluronidase, that will spread the infection. Streptokinase, fibrinolytic activity. Then we have two toxins, streptolysin O and streptolysin S. What does S indicate? This is the oxygen stable toxin. Hence, this will cause hemolysis on the blood agar as it can tolerate O2. Okay, that is on the surface. This is oxygen labile toxin. Okay, so it cannot cause hemolysis on blood agar. Okay, then you have toxic shock syndrome type 2, which is again a super antigen like the Staphylococci. What are the manifestation? So this can cause throat infection, which is known as pharyngitis, and if there is a molecular mimicry for that, it can cause acute rheumatic fever. Why? Because the C carbohydrate of the antigen that mimics the cardiac valve, and hence it can cause rheumatic heart disease. M protein antigen, they mimics the myocardium. Okay, so how do you diagnose it? If the ASO titer is more than 200, then it is a case of acute rheumatic fever. Further, it can cause skin infection like pyoderma, cellulitis, erysipelas, and complication is the post-streptococcal glomerulonephritis, which is a type 3 type of hypersensitivity due to molecular mimicry. Again, for diagnosis, anti-DNase B titer. So two things important came for the diagnosis. One is the anti-streptolysin O titer and anti-DNase B titer. Okay, so how does now group B Streptococcus? How I remember, group B stands for B is for baby, means it will cause something in neonates, that is the neonatal meningitis. It is the most common cause of neonatal meningitis. How do you diagnose it? I said it is gram-positive cocaine chain. The selective media is the crystal violet agar. This is a very important question. Okay, now this is catalyst negative. I said the first and most important thing between differentiating between the Staphylococci and the Streptococci, and group A and group B, this is bacitracin sensitive. So group A was Streptococcus pyogenes. Okay, so this pyogenes is sensitive. Okay, this is PYR test positive, and the transport media is the Pix media. This group B, that was Streptococcus agalactiae. This is CAM test positive. So what is CAM? CAM is Christie, Atkins, Munch Peterson. Okay, this is CAM test. Now coming on to the pneumococcus, as the name indicates, it causes pneumonia. As it belongs to the streptococci, it is catalyst negative, and this causes alpha hemolysis, that is known as partial hemolysis. Hence it is green in color. Okay, hence it is green in color since it causes partial hemolysis, and it is gram-positive cocci. This is the typical lanceolate swab. This is the most important hint in the question, guys. Try reading it if you find some big case scenario. Virulence factor, it has a capsule. So it has a capsule that is antiphagocytic. It has IgA1 protease. Why? Because it has to go to the lungs in order to cause pneumonia. So that will cause breakdown of IgA. You know, IgA lines the mucosa and the epithelium. Okay, hence it needs to break it down. We have pneumolysin that cause lysis of cell membrane. Okay, the most important thing here you might have heard is the Karam coin colony, also known as the Draughtsman appearance. Okay, now coming on to the clinical manifestation. See, it can cause pneumonia, name indicates. It can cause pyogenic or bacterial meningitis and pneumococci. What does it can cause? It can cause sinusitis, otitis media. These all things it can cause. How do you remember? S for sinusitis, O for otitis media, P for pneumonia, P for pyogenic meningitis. Diagnosis: gram-positive cocaine pair, which is Lang shape. Yeah, lanceolate shape, which I already discussed before, guys, and it is capsulated organism, and culture there is no selective media. I said it's alpha hemolysis partial. This is the most important thing. Carom coin or the Drotsman. Do you see? This looks like a carom coin appearance due to the presence of autolysin enzyme. Okay, this can be a MCQ. This was catalase negative. I said it. Alpha hemolysis. I said. And see, this is optosin sensitive, bile soluble. How can you remember? BIO. B is bile soluble, I is for inulin fermented, O is for optosin sensitive. Okay. Since this causes pneumonia, we can prevent it with the help of vaccine. So we have vaccine, that is PPSV vaccine, that is pneumococcal polysaccharide vaccine. That 23 is the number of serotypes included. Okay, 70% of the serotype cause meningitis, hence therefore beneficial more in adults. Okay, this is contraindicated in children less than 2 years of age. Okay, as it is less immunogenic. Okay, then you have conjugated vaccine, which is known as PCV13 vaccine. So it can be given in children less than 2 years of age. Okay, then coming on to the last one, that is Enterococci. That is catalase negative, because again it belongs to the Streptococcus category. Okay, and it causes gamma hemolysis, means no hemolysis. Okay, and how does this appear? This appears like a spectacle shaped. Okay, and it is non-capsulated, while Pneumococcus was a capsulated organism. What does this Enterococcus cause? Most common cause of UTI, wound infection and intra-abdominal infection. I said gram state. It occurs gram-positive cocci in pairs, which is a spectacle shaped, and culture. Okay, there is no selective media, and blood agar. I said it shows gamma hemolysis, means no hemolysis. Identification, again Streptococci, catalase negative, no hemolysis. But this is very important. It can tolerate 40% of bile and 6.5% of NaCl. Okay, this is PYR test positive. And see, this can tolerate bile, hence the agar uses the bile squalene azide agar. Okay, and see, now Enterococcus, there are two species. One is the fecalis, one is the fecum. Okay, it is most common. Fecalis is more common. Okay, it is less drug resistant. Okay, and it is sorbitol fermenter. Okay, so how can you remember? This is sorbitol fermenter, less drug resistant, and it is more common. Okay, now coming on to the gram negative cocci, that is meningococci and gonococci. So meningococci, this causes Neisseria meningitis. Gonococci will cause gonococcal infection. So I said there are only 3 organisms that are gram negative. So this is one of the more gram negative. We know gram negative organism appear pink, while gram positive appears purple. And gonococci, so like you write G, you can make a kidney out of it. Hence it is a kidney shaped organism which is non-capsulated. Okay, and see, now coming on to the virulence factor. Okay, this has a capsule which makes it antiphagocytic. Okay, then IgA1 protease that break down the secretory IgA, because it has to cause meningitis. Okay, and it has a lipopolysaccharide. Okay, so how can you remember? COLI. C stands for capsule, O stands for outer membrane protein, L stands for lipopolysaccharide, I stands for IgA protease. So what does meningococci cause? Meningococci name indicates it will cause meningitis. Okay, so it will cause meningitis. It will cause skin rashes. Okay, and it has a lipopolysaccharide, so it can cause endothelial injury. If it causes endothelial injury, there will be DIC, that is disseminated intravascular coagulation, also known as the consumptive coagulopathy. And due to endothelial injury, there is an increase in vascular permeability, hence can cause septicemia and shock. And this is one of the most important MCQ, that is Waterhouse-Friderichsen syndrome. So what will happen? All the features that we read: skin rash, meningitis, DIC, and furthermore it can cause septicemia, septic shock, and bilateral adrenal hemorrhage and multi-organ failure syndrome. Okay, how do you diagnose a case of meningococci? So meningococci, how will you diagnose it? So meningococci are gram negative cocci in pair, lens shaped, capsulated. Okay, so here it was written out, this is a capsulated organism. Okay, on culture, so there you have a selective media that is known as the Thier-Martins media, which is most common use, and you have a modified Newark media. Okay, now coming on to the identification. Okay, so meningitis. Okay, see, and one is this and one is the gonococci. Okay, So gonococci is just glucose fermenter, okay, and meningitis is both maltose as well as a glucose fermenter. How do you prevent it? Again, it is a capsulated organism, so you can form a vaccine, okay. So you use 3 strain A, C, Y and W135. B is not used. Why? Because it causes encephalitis, hence you do not use it, okay. And it is contraindicated in less than 2 years, like PPS. V23 you cannot use it, or you can use a conjugate vaccine. Now coming on to the gonococci. So it causes Neisseria gonorrhea. We know it is the cause of infection, UTI infection, okay. So they are gram negative cocaine pair, okay. This gonococci is the kidney shaped organism, okay, and this is non-capsulated, okay. Virulence factor, it has a pili or fimbriae in order to attach to the urinary tract. It has IgA protease to cause breakdown of secretory IgA, and again lipo-oligosaccharide that will cause DIC, septicemia, shock. Now what does this organism cause? In man, it can cause urethritis, and most common cause of urethritis is the gonococci, and this is one of the most important, that multiple abscesses known as water can perineum. In women, it can cause infection of the vulva, vagina known as vulvovaginitis, or of cervix known as cervicitis, and it can cause perihepatic inflammation known as Fitz-Hugh-Curtis syndrome. But most common cause of Fitz-Hugh-Curtis syndrome is the chlamydia, okay. In neonates, it can cause ophthalmia neonatorum, okay, due to pustular discharge. It can cause disseminated gonococcal infection. Microscopy we have already talked about. Selective media is same for both, that is Thier-Martin media and the modified New York media. And transport media is very important for Neisseria, that is Ames media and the Stewart media, okay. Now coming on to the identification, I said this does not have M, hence it is maltose non-fermenter, okay. It can cause urethritis. Then you have also a question come, non-gonococcal causes of urethritis. In bacteria other than gonococci, what causes urethritis? That is the chlamydia trachomatis and mycoplasma hominis. Virus, it can be herpes simplex virus, cytomegalovirus. Fungi, it can be candida albicans, and parasite, it can be trichomonas vaginalis. So guys, in this video we will discuss till here. We'll further move on in the part 2 guys. Stay tuned, like, share, subscribe guys.